Wow, well, thank you, Dr. Boutros. I'm Ted Wymyslow, and I get the distinct pleasure of introducing Dr. Acton, but I'm the past senior medical advisor of the Ohio Association of Community Health Centers. I was the director of health with Governor Kasich for 3 years, and then I'm also on the Better Health Partnership Board. So when you're on the board, they put you to work, and so I'm tasked with really a great task this morning, which is introducing Dr. Acton. But I wanted to reflect on Dr. Boutros just for a second. When Dr. Boutros first came to Ohio and decided he was going to lead the Metro Health System forward, he scheduled an appointment with me at the Ohio Department of Health. And I said, wow, that's kind of unusual. And actually for 3 years, nobody else that was the head of any healthcare system ever scheduled an appointment with me. So it was quite unique. So after the meeting, my staff said, what'd you think? And I said, don't bet against him. And I think that he turned out just as well as I had expected he would, and asked for my input on his vision, mission, and his direction he was taking, which had a strong consideration of public health. And you can feel it in what he says, that he's maintaining that commitment to public health in all his work that he does. Well, again, it's my honor now to introduce Dr. Acton, and I'll read a little bit from her bio, but I'd like to get a little more personal if I can. She's a licensed physician in preventive medicine and public health and has over 30 years experience in executive leadership, philanthropy, public service, of course, teaching and advocacy. Among her many honors, she received the JFK Library Profile in COVID Courage Award, a national level award for her leadership as director of the Ohio Department of Health during the early months of COVID-19 pandemic. And she was also named one of USA Today's Women of the Year, so another national distinction. Her passion is helping to create the community conditions in which all our citizens can lead flourishing lives and contribute to their fullest potential, so optimizing performance of all the people in the community and health of everyone in the community. She's currently president and CEO of Rapid 5, and I'm sure she'll tell you a little bit about that as we work through here, but it's a newly established public-private partnership that's serving Columbus and Central Ohio, and her goal with that is to create the country's largest integrated waterway and park system, if you can imagine. What a shift from prior focus, but actually not. So if you've kept up with National Academies of Science, Engineering, and Medicine work that they've been doing, they've been talking a lot about integration of ecosystem health and public health and how those fit together and how critically important one is to the other. And so she gets it, but she's doing something about it, sort of like Dr. Boutros, actually going to do something about it, not just think it's really important. So we're strongly supportive of those efforts in Central Ohio, and I hope every community will take on those type efforts to try to improve public health by looking at ecosystem health more seriously. She lives in the Columbus area in Bexley with her husband Eric, who's coached and taught in Bexley school system since 1987, so they're a stable fixture for us for sure in Central Ohio. Her keynote address will focus on leadership and lessons learned in her role as the director of the Ohio Department of Health and as a cabinet member for Governor DeWine. So I can't kind of wait to hear about how that's going to go. And then we got a picture up there too. On the prior one, you can see my new role as a retiree. So I'm usually found in the woods or on streams or other places because I've been indoors for like 45 years of my life. And so I've been always an outdoor person that was stuck indoors. So now I'm allowed to get outside and participate in some of the things that are important to me. But one other comment I want to make about Dr. Acton, she's a person who leads with her heart as well as her head, made a lot of good decisions during a very difficult time of the pandemic, but you always felt the heart in what she did and didn't feel it was just like some talking head out there that's just saying what they're supposed to say, but instead passionately spoke to people and hit them emotionally in a way that other leaders many times don't or can't. And just like Dr. Boutros, you feel the passion when they're making decisions and encouraging you to be a part of the solution to the problems that we see. To help you understand a little bit of what happened, we will play a short New York Times video from May of 2020, right when Ohio was starting to reopen. And this was put together by New York Times, and I think will help you understand and maybe have her launch into her talk. So let's move to the video next, and thank you all very much.
This is no small thing that we are doing together. It is so incredibly hard to have shut down our lives the way we have. I am absolutely certain you will look back and know that you helped save each other.
This is Dr. Amy Acton, Director of the Ohio Department of Health. Trademark lab coat, emphatic hand gestures, and a knack for metaphors.
It's like Swiss cheese. So I want you to picture a hurricane. When you have a fire on your stove and you have your kitchen extinguisher, you want to get it quick.
You may not have seen her press briefings, but in Ohio, they've become a daily ritual, catapulting her from unknown local official to cult icon.
Hi, my name is Amy Acton. Any questions? Dr. Amy's going to help us find out the coronavirus.
In her youth, Dr. Acton overcame neglect and homelessness on her way to being crowned homecoming queen. And last year, she became the first woman appointed to run Ohio's health department. Under her, Ohio has become a leader in responding to COVID. It declared a state of emergency with just 3 confirmed cases. And it was the first state to shut down schools. Later that same week, some governors were still proudly eating in packed restaurants. And Dr. Acton issued a stay-at-home order affecting more than 11 million people when the death toll was still just 3. So how did Dr. Acton do it? To find out, we watched more than 7 weeks of press briefings, and we noticed themes that, well, let's just say other leaders should pay attention to. First up, she empowers us. Take a look at this clip from the day Dr. Acton issued that stay-at-home order.
I don't want you to be afraid. I am not afraid. I am determined. But I need you to do everything. I want you to think about the fact that this is our one shot in this country. All of us are going to have to sacrifice. And I know someday we'll be looking back and wondering, what was it we did in this moment?
Of her 65 words there, 12 are pronouns. Her repeated use of I tells us she's in it with us. She's taking ownership. Her use of you makes the audience feel a connection with her, even though we're watching from home. Toward the end, she switches from singular to collective pronouns, signaling that she's just like us. And we're in it together. She's in charge, yet she's made us feel like the heroes.
There are everyday heroes everywhere. We know that not all heroes wear capes. You're heroic when you stay at home and watch your neighbor who's a nurse's child. I know you're all donning those capes in big ways and small ways. Please help us. Thank you.
Ohioans were inspired, not just to stay at home, but to spread her messages to each other. Another theme of Dr. Acton's briefings is brutal honesty. And to understand this one, we have to take you back to mid-April. People were getting restless, wondering when things would get back to normal.
So I do hope no one at home thinks like it's wide open May 1st, going back to life as normal. The rules have changed and they're not going to be quite the same. Life will be different for quite some time to come, and maybe in some ways that are permanent.
She's preparing us for the long haul, even if it's not what we want to hear.
It's really hard to hear that, but we are not going back to 6 months ago. That's not the reality we all face.
This is something she does a lot, actually. Setting up bad news with a warning.
Ohioans, I know that's hard to take. I know that's a hard truth for people because we want there to be a right answer and a right way. And I know this is a deep breath we all must take.
Dr. Acton's also honest about what she doesn't know.
You have to be very clear and transparent with you. All of these numbers are a gross underestimation, and we have no real idea of the prevalence of this infection yet.
A lot of leaders just avoid talking about uncertainty, but when Dr. Acton repeatedly says,
"We don't know,"
it's actually calming to hear her admit what we all feel deep down, that we just don't have the full story. And finally, Dr. Acton sees vulnerability as a strength. After watching dozens of hours of briefings, there was one word we kept hearing over and over:
Please just acknowledge and give a name to what you're going through. Acknowledge it with each other. And so I just want to acknowledge that these are still really tough times. This is wearing on all of us, and I just want to acknowledge that. I just want to acknowledge that all of us are feeling this. It's such an unprecedented time.
Hearing Dr. Acton acknowledge our harder emotions forces us to face them head on. Stuffing down fear and sadness just causes more stress and may make us act more selfishly instead of empathizing with each other.
You'll have days when you're anxious, but don't kill yourself over that. Please know and forgive yourself and try again.
And take a look at what she does here.
Every day I go through stages of grief. I go through, denial. I go through a little anger. I go through a little bargaining. I don't have to wear this. I might not need it. This isn't true. I get a little down.
When she tells us she's struggling too, we feel seen and heard and less alone. And maybe that's all any of us want right now. In a pandemic, the words our leaders choose can save lives. As of the end of April, Ohio had recorded fewer than 1,000 COVID deaths. By comparison, neighboring Michigan suffered more than 3,000, even though Ohio has a bigger population and had its first case 3 weeks earlier. Of course, other factors help explain this. But Dr. Acton convinced millions of Ohioans to stay at home, not by ordering them, but by inspiring them.
People at home, you are moving mountains. You are saving lives. Again, I get emotional talking about this because this is no small thing that we are doing together. It is so incredibly hard to have shut down our lives the way we have. I am absolutely certain you will look back and know that you helped save each other in this state. The impact is profound. Please at home, don't stop.
Hi, everyone. Good morning. Good morning. Hi. Oh, well, sorry, the quality of that was it got off a little bit, but just the gist of that, I can't wait to share with you what all of you did during the pandemic. That was them analyzing what Ohio did. This was May of 2020, and it takes you back. I don't know about you, but whenever I see scenes from that, it's sort of, I know for the people in this room, there might be a little bit of trauma associated with just remembering what it felt like in those moments. And Dr. Boutros was exactly right. It all sort of began at Metro Health. And so first of all, I want to say thank you for having me. Dr. Wymyslow and I were in the middle of a creek not too long ago in the middle of a river, cleaning stuff up. He's not kidding. We're trying to heal ourselves. He was an amazing leader of the Ohio Department of Health under Governor Kasich, and people just don't know what kind of job this is. It was an amazing job before a pandemic, but it changes you for a lifetime. And I have to tell you, it was the honor of a lifetime to serve on behalf of Ohioans. It's something that's going to be with me for the rest of my life. And so I want to use this opportunity, first of all, to say that I hope we don't yet take being here all together for granted. That together word is a very important word. It became one of our mottos in Ohio, we're in this together. And those memes saved lives. I really do believe. And it wasn't the actions of a health director or an order. It was the actions of all of us collectively. And Together is actually the name of the Surgeon General's book. I just saw him speak this week, Vivek Murthy, our current Surgeon General. And his book really spoke to something Dr. Boutros just said, that it's all about connections. He really believes that all of our epidemics and diseases of despair at the root cause have to do with isolation and loneliness and despair. And that connection, if done well, is the antidote. And I think that no matter what these issues are we're going to talk about, that's always sort of the root cause. So I don't take being here for granted. I want to take you back, if that's okay, and I'll share with you. Maybe a few of you have seen me speak. I do apologize if you hear some of these stories again, but I think it's really important for us to maybe hear some of the background history. Someday I'd like to write a book about all of this. It's going to be a while even for me to process all of what I'm learning, even still. But I want to take you behind the scenes. And I want to start out with that t-shirt you saw. The Not All Heroes Wear Capes. It was March of 2020, and so it's just beginning. I had just returned here to Cleveland. I had been a few weeks before. I ended up being the representative for the whole Midwest of my position. There's one of us in every state and territory, which put me in the White House the last week of February. And if you remember, that was when the stock market crashed for the second time. That got everyone's attention. Fortunately, in Ohio, we began preparing early. And we're seeing the trends of this happening around the world. And I, like you, couldn't understand why it wasn't being named a pandemic yet. I taught global public health for years at Ohio State, but Googled the word pandemic. And I'm like, why is the World Health Organization not saying this word? And ended up with Mick Mulvaney in the White House. Right as Nancy Messonnier from the CDC came out and said, go home and tell your children their lives are going to be disrupted, she got hooked, stage left. And I said to him then, there was a room full of people who have advised multiple presidents, virologists, epidemiologists, and there was one in particular, Dr. Bob Cadlack, who served in that capacity for many presidents, and he had been to the Japanese Princess, the ship where the infection was spreading, and he was just shaking. So you didn't need to say anything at that point, you just knew. And everyone went around the room. It was like that launching off point of a war, and said their best advice to Mick Mulvaney, the chief of staff. And it got to me, and pretty much everything had been said. And I don't know why it struck me in that moment, but I said, I really believe you need to tell the president that this is the higher angels moment. This is the FDR Winston Churchill moment. We are at war with a common enemy. Unfortunately, that enemy is invisible. I used to say in my public health classes that if only we had aliens invade from outer space, we'd realize we were all on the same team facing the same thing. And that's what this virus was. If it was Ghostbusters and you could throw some green dye on it, you could see little blobs floating around, we'd be like, yeah, we're gonna get you. And we'd all join. We had actually taught the world how to all work together in just this moment that we had feared ever happening. I remember Mick Mulvaney just shook his head. 2 weeks later, he was gone. I jumped on an airplane, flew back with the governor, met him at Metro Health to tour that unit. And we had the very first press conference. And we came out and we made a promise to Ohioans. We said that we will tell you the truth as we know it. Whatever it is, we would just tell you that, because that's what I was longing to hear. And that began the adventure. We literally got in a car, started driving back to the State House and making the Arnold Classic decision on the way back. So somewhere in that month of March, as we're making all those really impossible, very hard got policy decisions that really put us out in the lead, I got a call from Ryan Vessler. He is the gentleman who created Homage, the very cool apparel t-shirt company that a lot of young people like. And he said, I want to help. I want to make a t-shirt, a Dr. Amy t-shirt, because you're trending. And I said, and he wanted to do it for youth homelessness, which is something I'm very passionate about. And I said, well, what you have to understand is that you're going to know me for about a week or two. I thought it would just be a week or two. But before this is over, there's not one person who is not going to have to be a leader in some capacity or another. This is going to be a relay race. The baton is going to be passed from person to person, from nurse to superintendent to small business owner to everyone. And that's when he came up with the Not All Heroes Wear Capes. And that became our mantra in Ohio, from little kids getting shots wearing capes to all of us wearing that t-shirt. And it raised hundreds of thousands of dollars for youth homelessness. but became that mantra. And that's what I want to say to you today from that. It isn't an order I wrote. There are not enough orders you could write. And as Dr. Wymyslow knows, only the director can actually have the signature authority. What we really had to do was ask each and every one of you to reach out and grab somebody near you and pull them up on the life raft. And so that's what our press conferences became. So I want to tell you a little bit, again, I'm an ordinary person. I can't say that enough. Very ordinary person, live in an ordinary house in an ordinary neighborhood. And I just ended up in that moment. But I want you to think about what you would do if you were in that moment. I think we all wonder, you wonder, will I have the courage? Will I, if I'm in a war, what would I do? But I can tell you that being in that moment, all I could think about was there were 11.7 million of us, and I didn't want to lose anyone. And that's a very motivating thing. So those qualities, they said, brutal honesty, vulnerability, and empowerment. Now, and years later, as I'm watching leaders of all types, those words really, I think, were an incredible analysis of what I think we're asking for in our leaders. I'd like to say I was super deliberate about that. The truth is, I was not press trained. They train us in public health to do crisis communications, as Dr. Boutros was saying. You have the C's. You're going to be clear, concise, credible, sometimes compassionate, and consistent. But those fell very short in a humanitarian disaster of this scale, scope, and duration. But what happened is that we all ended up there together in a room. I don't think that happens in anything else we do. It started with that first press conference, but you couldn't binge watch us, right? You had to come every day. And it was completely unscripted, which is never, ever done in politics. So that really is a testimony to the governor to have created that space for a doctor and a mom, not a politician. I keep saying I'm like the Ted Lasso of politics. I didn't know anyone at the State House the first day I swore in, and they said, you're in 12 lawsuits already, get going. And I'm like, what? As a doctor, what? And that began the adventure. And we did all these amazing things, from have an incredible opiate settlement here in Ohio, where we set aside that money into an endowment, a huge amount of it, for perpetuity. We did VACO 21, we dealt with Legionella outbreaks, all sorts of things. But it was this moment of hearing one woman's voice at the end of December saying, a weird pneumonia is in Wuhan. And I remember driving to the State House, and the traffic's all going in every direction, like every day. And I'm thinking to myself, what are the words you can possibly say to explain what is going to happen in this country? And what people don't know is right after 9/11, George W. Bush was given John Barry's book, The Great Influenza. I've gotten to know John Barry very well now as an author. He's a historian. And they found out that the gravest security risk to this country, not just to put the disease and all the horror that we're still dealing with aside, the gravest security risk to this country was a pandemic or a biologic weapon. And what it does, they realize, is that it greatly unmoors the world. And we're still unmoored, I would say. We're still in a phase of this pandemic. And we knew very quickly that our supply chains would be completely disrupted. I sat with all the hospital CEOs who I got to know well, and the heads of prisons and nursing homes and homeless shelters. We couldn't get amoxicillin in this country, or a cotton swab at times, let alone 3M masks. The little inner layer could not be made in this country anymore. Some of the blessings that come out of a disruption like that is, I think it's an incredible moment for Ohio and the supply chain coming back and us understanding that vulnerability. And then what they realized was that bad actors take advantage of those moments of weakness when people are unmoored. And just like 9/11, I remember that feeling that we all felt for about 4 days. There wasn't a stranger in the world. And I kept thinking about that feeling, and I just thought, how do we create that feeling again? And that's where a lot of the press conferences came from for me. And the second we told the truth, the best people in the world, Michael Lewis has written a book called The Premonition about this. He and I talk about it. We're fighting for a 9/11 style commission to study it. But the scientists who first came out in January were sort of attacked and they had to go underground. They became something called the Red Dawn. And when we started telling the truth in Ohio, the best people from around the world started calling us. There were other serendipities that happened. I had hired a communications director 4 days before it really hit the fan. It turned out that her brother, Rajiv Venkaya, had gone to medical school with me. I'm from Northeast Ohio. I love this area. As you know, I grew up in Youngstown, went to Neo-UCOM, Neo-Med, and 2 years below me was her brother. He had helped write the pandemic playbook for George W. Bush. I did not know that. She said, my brother, he knows a little bit of something about wastewater and measuring viruses. I'm like, what? And so he took me to Carter Mecker. Carter Mecker's who's written about in The Premonition and all the people who developed the strategies. So make no mistake, what we did together was throw the emergency brake. You never want to have to throttle back the way we did. But the mortality rate in March, if you ended up in the hospital in March of 2020, the mortality rate was somewhere near 25%, I've seen in some studies. For those of you who are bedside, and I know you're in this room, it was a horrible thing to watch. People don't understand how brutal this disease was. And that to put someone on a ventilator and intubate them, which is no fun thing on any given day for someone, and not be able to get enough oxygen in someone is a horrible thing. It's horrible for the patient. It's horrible to witness. By June of 2020, that rate had fallen back down to 5%. So that emergency brake, you never want to pull it, but that bought us the time to begin to learn how to deal with it. What I learned in our pandemic playbook, and why I hope that we have a 9/11 commission, which many of us are fighting for, is that we need to learn how to throttle out of that better. There were plans made. The White House had a plan. The American Enterprise Institute, Scott Gottlieb, very conservative organization, had a plan. The National Governors Association had a plan. In Ohio, we started planning reopening in March of 2020. I put together a team to start thinking about that. But politics took over, as we know, and a lot of that didn't unfold right. But I would also say the plan needs to have a whole new toolkit on what happens in this phase. Because quite honestly, we are still in a phase. And we really are still craving leaders who intentionally help us make meaning and lead through this part. The world is not quite the same. It's not going back in the bottle, the genie. At the same time, in the times of most disruption, we know things can go one way, a bad way. It's also the time you can make changes unlike any other time. It really opens up new innovation. So I can tell you, we did not have the data analysts who could do the numbers I predicted. When I do my job in public health and I knock it out of the park, and I remember telling this to the legislature, you have silent victories. You don't see what we prevent. The kid who didn't die of polio, all those things. That's when I'm doing my job right, which is what makes public health so hard. That's why it's so hard to fund it. We predicted those numbers at the beginning. I ended up gathering something called the Force. It was data analysts from the Cleveland Clinic and universities all over Ohio who could crunch those kinds of numbers. We don't even have in this country data systems that could keep track of this sort of thing that are functioning well. That's one of the things we learned and discovered. But these analysts worked tirelessly day and night as volunteers, and that's how Ohio got the good numbers. And of course, we did flatten that curve in Ohio. And again, it was the results of Ohioans. Not all of us have to do it right, but if enough of us do it right. And so my wish is that we have this steady and go forward. I want to tell you a little bit about vulnerability. Now, again, I wasn't scripted. I'm not a politician. So I think I just deferred to talking like a doctor or a mom. And one of the things, a Kenyan professor studied the press conferences and said we created this ritualized holding space we all came together, and that's kind of what we often have to do in healing. A lot of times we can't fix all the worst things, but being with itself is very, very powerful, and we can't forget that. I don't want to minimize the hate that you saw. I had January 6th characters in my yard. I had executive protection from March on because what was on the dark web. I didn't know till later that there was a safe house for my family. There were the anti-Semitic slurs. I'm Jewish, my husband is Episcopal. At my house, my Christmas decorations were still up because I'd been so busy working on the pandemic. No one seemed to notice that. And some of that came from people in the legislature, people who know better. But the truth of it was, and Ted will tell you this, that we have mail rooms that are like maybe 2/3 the size of this room, one at Ohio Department of Health, one at the governor's office. You could not walk through those rooms for what Ohioans made and did and sent. Ohioans started making art, they started making meaning, they started doing things to help one another. I would talk about 6 degrees of Kevin Bacon spread of infection, and there was a giant bacon statue made, 6 foot tall, that was in a Cincinnati office park. I once played or talked about a song I'd seen on Colbert by Michael Stipe from REM, that there's no time for love like now, and got a call from Michael Stipe. And who really was, he had gotten COVID early on. He had gone from New York to Georgia to stay with his family and wanted to do something to make a difference. So people all over the country were watching Ohio. Bonnie Bowen, there started to be the fan club, fan page. And again, I was so busy working behind the scenes with everybody, like doing the emergency response. I wasn't getting to see it all in the beginning. But Bonnie Bowen was 90 some years old, and she did a watercolor every day documenting the progress of the pandemic, and all these folks followed her. And then somewhere way later in the progress, she got COVID, and people sent like hundreds of thousands of prayer messages to her from Ohio and around the country, and she got better. And again, I've always believed that her doing that kept her alive through that, and what we did back kept her alive. And so these stories went on and on. There were signs that said, act on love, not hate, a play on my last name, which I would never think of. And we started saying, act on love, not hate, kindness, not fear. Kindness is often seen as weakness, big mistake. I call it fierce kindness. Niceness is that superficial thing we all do, where you kind of fake it and you go behind someone's back and give them a little stab, but you're not being real. Part of that brutal honesty, the kindness is this age-old enduring principle in every religion, in every mythology, in every philosophy through time. And what it really is what Dr. Boutros said. It is the humanity. It is the human in me seeing the human in you. And that's what we started saying, that there is a contagion worse than a virus, and that is fear. And what we started to realize is we had to help people fight off fear and find that courage in themselves to help one another. And that doesn't mean you're not afraid. Courage comes from core, which is heart, which just means opening your heart. This pandemic just broke us open. It unmasked things that were already there. But that's also the beginning of our humanity. When I talk to young people, I don't see them as Generation C, which is what I call them in my mind, for COVID. I know they're hurting and they've gone through a lot, but I have a lot of faith in this generation. When we were on air, we talked about George Floyd. I talked about his call for his mother. The governor, after a very heated conversation, came out and said racism is a public health issue. We were having our hearts broken open. And I see this generation foresee for all their courage and the compassion. They're willing to have the hard conversations that we have to have. Kindness is having hard conversations, but holding that space for humanity. And that is the legacy I see. So lastly, I want to just talk for a moment about empowerment. This is not over. We know that. We're still all unmoored here or there. I have good days. I have bad days where I get up and just one foot, crawl in bed and start again. But I believe this is the time we must co-create the world we want to live in. There's a bipartisan commission that has studied democracy, and they do believe that we are at a fourth founding of our country. When we began Reconstruction in the Civil War, the Civil Rights Movement, these times of great unmooring, they recycle through development. Like cultures have developmental stages just like people. And you have to stay alert for this and be intentional, because right in this moment, I believe, is real threat. I mean, as an ordinary person, to pull up that hood and look underneath it and look in the eye some of what I looked into, it's not pretty. You know, we've let a lot of things languish, like our data systems, etc., that we have to fix. But at the same time, the will of our hearts and souls is very, very strong. But we have to do that together. Like, we have to keep pulling each other up on these life rafts, looking for those ideas, like Dr. Boutros said, finding those people we can gather around with. Because right now is the time for co-creation. I believe that this is going to go on like this for a bit. We are going to study this. We are going to make memorials to this. We will mourn, finally. We have lost so much more than we can calculate. The numbers are gross underestimates still, and we're dealing with long COVID and all the cascading consequences. But we will make meaning out of it. And that's what we need from you, the leaders we wish we all had. If I could be in a moment like that as a very ordinary person, I promise you I am. Very normal, all the same human frailties. All of us have those moments when we can't look the other way and we don't know when they're going to find us, when they're just going to grab us and find us. And so I want you to think about this as you go forward. It's been an honor of a lifetime to serve you. When you get lost, try to own it. Try to be honest, which is putting the hard cards on the table. It hurts, but from my childhood, that's what I learned. I could take any crisis when I just know the ground I'm standing on, because that's when you begin to solve the problems. So try to be honest. Find that open-heartedness where you can, but be fierce. Tell that truth, and then look around to who you can power to go with you. And it's an honor of a lifetime to have served with you. Thank you for all you've done leading, because I know you've all been on those front lines. And I look forward to the conversation ahead. Thank you. Honor.
Dr. Acton, thank you so much. That was an amazing journey that you shared with us. I would only have one very small objection to the characterizations that were made about brutal honesty. I would say that honesty is never brutal. Honesty is always kind. And thank you for your honesty with us.